We really have to encourage people more in their early 30s to start taking care of their neck, because I feel like you start to hit a certain age and then you're like, oh my gosh, I didn't take any care, rather than just being preventative.
Real skin, real science, real confidence. With Dr. Zain Hussein. Welcome to
Skinside
Out.
Welcome to Skinside Out, where science meets beauty. I'm your host, Dr. Zain, with Heather and Courtney. So you may have heard the phrase, your face can lie, but your neck tells the truth. And I think there's a lot of wisdom in that, especially in the cosmetic realm.
I've never heard that.
I think it makes sense because most people will take care of their face and do all their face treatments, put all their serums on, and we neglect the neck, and we
neglect
forget
the neck,
and the décolleté
And the hands.
There's a whole song, Protect Your Neck.
Protect your neck. That's right. So, we spend so much time focusing on, the skin on our face that we tend to neglect our necks and other sensitive areas that are also cosmetically visible. Mm-hmm. So it can give away your age, especially if you're doing procedures or, you're just, using sun protection on your face, for instance. You can tell a big difference. Mm-hmm. So, and the neck is a very delicate tissue as well. It ages differently. It gets affected by sun differently. So let's dive into why does the neck age so quickly?
I think it's very similar to our last episode talking about the under eyes. A lot of things that we mentioned do, apply to the neck aging as well. So it's a very delicate area. The skin is a lot thinner there compared to our face. And so we lose collagen and elastin very quickly there. We're always moving our neck. Mm-hmm. I think we see a lot of tech neck. So from keeping your head down can, create more lines or accentuate that aging. Sun exposure, I think, is a big one. It's any sort of, and similar thing, we apply sunscreen to our face daily, hopefully, but we forget to bring it down to our neck and chest. And the more UV damage we have, and free radicals that are forming, the more that skin can thin, the more the aging can be noticeable too.
Yeah, and a common pattern that we see is poikiloderma, where we see that kind of ruddy, brownish dyspigmentation, especially on the sides of our neck. And typically the center is spared because our chin often blocks the light there, so sun protected. But we do see a lot of that in many of our sun worshiping patients, and it does age the skin tremendously. And, it's very difficult to treat. So we'll go into treatment options for that, but that's another reason.
I think also genetics and lifestyle can play a role with the neck too. Any skin on the body, but it's more noticeable, similar to the under eyes. It's more noticeable than other areas. So smoking plays a big role with the integrity of the neck. Weight changes, especially like weight changes, more so. Weight loss, I think we see a lot more laxity. Posture can play a role too, like we mentioned with the tech neck, and can definitely accentuate different areas on the neck.
Yeah. So let's dive into the neck anatomy. So we're really talking about the skin and the, more superficial structures. We're not going into the airways or more complicated anatomy like that. So what we're going to be talking about is the first layer, the skin. So Heather just kind of alluded to the skin being very thin, it's delicate, it's more prone to damage. So that is kind of where we see that initial sun damage happening. The fat below the skin layer is relatively sparse, so it's very thin. And right below that is the platysma muscle. So this is a very thin muscle that envelops the neck, attaches into the mandible, and that's really the muscle that we're constantly using when we're moving around, and that leads to the tech neck. So this muscle is constantly being worked, and as the muscle weakens, this creates platysmal bands like the turkey neck, and those little rings that we see on our neck. So these are some of the reasons why. It's more from the muscle contraction causing that. And lastly, obviously there's bone attachments, where you have your mandible into the clavicle, the collarbone. So, the muscles kind of attached to that area as well. All right, so let's talk about preventative and at-home treatments that we can do to help improve our skin quality of our neck. So, Courtney, let's dive in.
So there are topicals that you can use at home, kind of similar with your eyes. I always say these are things that, are not going to be a one-step fix for every neck problem. I think, neck creams especially, I think they can be helpful for patients with certain conditions like the crepiness or the texture of the skin, but it's not going to fix that turkey neck. It's not going to fix the laxity, unfortunately. But there are things that can help. So things like retinoids, with the neck being a little bit more than the face. I do normally recommend patients using it maybe twice a week rather than not every night. Growth factors. I love growth factors, especially when you can find a neck cream that has a good growth factor, like the Neocutis neck and Decollete, I really like a lot. Vitamin C's, again, can help with building some collagen, preventing those free radicals, and just helping with that overall sun damage. And then sometimes for things like the poikiloderma, I've recommended hydroquinone in the past in conjunction with usually like IPL or other lasers. So I think, talking with your dermatologist or your provider and seeing what would be a right fit for you.
Yeah. And what are your thoughts on using the same skincare on your face for the neck? Do you tend to find that is, tolerable, or do you think that you need different products for your neck?
I think it depends on the product. For retinoids, you have to be a little careful because your neck can't tolerate as much as your face can. I think for most other things, I would use it on the neck. The products that I'm using on the face, like the vitamin C, any sort of like peptides or collagen stimulating products.
Yeah, I agree. It's funny. I was just having this thought earlier this week. I had two thoughts. Number one, being 31, I was like, we really have to encourage people more in their early 30s to start taking care of their neck, because I feel like you start to hit a certain age and then you're like, oh my gosh, I didn't take any care, rather than just being preventative. But my second thought also was just about products. And I was thinking to myself as I was using my bio serum and then my Lumiere eye cream and then my neck and décolleté cream, I'm thinking to myself, if someone could only afford one product, then I might say, okay, use that bio serum and go ahead and put it under your eyes. Go ahead and put it on the neck. So I think it does depend on the product, but I think there are some products you can kind of get away with using for both areas. Vitamin C being one of them, for sure.
Yeah, I definitely get sensitive with retinoids on my neck. I definitely get irritated.
Yeah. I'll put any sort of like retinol eye cream that I use, I'll use that on my neck more so. Going back to the sunscreen too, just to reiterate, applying it all the way down. But I think a lot of times we forget about the back of our neck too. And there's this condition called cutis rhomboidalis nuchae, which if you look it up, it kind of looks like a rhomboid shape.
Yeah, like I call them diamonds.
Diamonds on the back of the neck from sun exposure. So just remembering to apply your sunscreen there as well, because we see a lot of significant sun damage in that area.
It's funny, like when I was a kid, I never wore sunscreen, and like I'd be out in the sun all the time in the summer, and the back of my neck is a totally different shade than the rest of my body. It's weird. And like even though I wear sunscreen now, it's been years like of sun protection. It's a totally different skin color.
It is. I'll speak to that.
That's why you burn me.
But you're catching it early, because I think there are some people who will use, take care of the front, but it's a clear distinction, a lot clearer than yours as far as what they're doing to protect their skin.
Yeah. So let's talk about some non-invasive treatments that can help the neck. So let's talk about tox. How can we use tox to improve our neck skin quality? So
tox or neuromodulators are used to relax muscles. And like Dr. Zane was mentioning, there are muscles in the neck that contribute to like the turkey neck or like the horizontal line. So if we can relax those muscles, we can therefore relax those lines. We do often use neuromodulators in those areas. So like if you make the turkey neck like this, I have a pretty bad one.
Courtney, do it.
I've actually never gotten it in my neck.
Yeah,
but,
I haven't either.
It works very well. I think we see phenomenal results with it. And you can even do a little like Nefertiti lift if we put...
I love me a Nefertiti lift.
Yeah,
Looks
it works
good.
so well. So if we put neuromodulators in kind of like right below the jawline, it kind of helps tuck that skin in just a little bit more and snatch your jawline a little bit. But it'll help kind of smooth out and pull your skin to smooth out those lines.
Yeah. I mean, I think that Tox is a great option. It's relatively quick, easy, non-invasive, and patients tend to be satisfied.
Yeah.
But that's kind of addressing more like the muscle, right? So let's talk about the skin itself and, collagen and trying to improve like the thickness of the skin because, your neck does get crepey. So we want to kind of increase that collagen synthesis to help improve that integrity. So I'm a huge fan of using, technologies. I really do like combining modalities. I like radio frequency. Microneedling does a great job with tightening the neck. I also like non-ablative fractional lasers. So the combination of those treatments tend to get a really nice improvement in the skin quality. It also helps with, the hyperpigmentation from sun damage, especially with that 1927 nanometer wavelength. It does a great job with that.
Our office is definitely the first office that I've worked at that we treat both face and neck. And I think that's why it gets so neglected a lot of times. Different practices that I've worked at, maybe you're charged extra for the neck or, things like that. Whereas when we are quoting someone, we're quoting for face and neck. And I think that's so important because, again, going back to if you just keep treating the face and you're not treating the neck, there's going to be such a stark difference in the appearance of that. And that will give away your age. So I think finding a provider that at least has an open discussion with you about treating that area too is so important.
And I kind of made that a point when I was creating my office policies. I do want to address the head and neck because it is a cosmetically sensitive issue. And if we kind of have a more cohesive treatment, you're going to have a better outcome and my patients are happier. And, I think that's what it's all about, right? We get, optimal satisfaction.
And let's be honest, how many people wear turtlenecks anymore?
Me!
Days? Oh, you do?
That's my whole winter wardrobe.
Oh. I thought they were out of style. I don't know. I guess I live under a rock.
I'm sure they're coming back in, though. Like everything from the 90s is coming back.
I love a turtleneck. If you look at my closet, I'm not kidding you. My winter side is probably 70% turtlenecks. I have one in every color.
I don't think I own a turtleneck.
I live
I don't
and
think
die in a
I
turtleneck.
I don't like that
Bury
feeling.
me in a
Me neither.
turtleneck.
I'd rather wear a scarf.
I feel like I'm in a noose. Like I can't have things around my neck.
It's like a weighted blanket. I feel like
That's another reason why I don't
cozy.
like wearing ties. I hate wearing ties. I feel like I'm like being strangled.
I'm going to send you, I'm going home tonight and I'm sending you the picture of all my, it's ridiculous.
Okay. I won't get
So
full
for anyone
details.
except for Courtney, you probably don't wear a turtleneck.
Out of everybody, I won't explain, but I wouldn't have thought you would like turtlenecks.
I know.
You know what I mean?
Yeah. But
I would have seen you as a turtleneck person.
I could. Yeah.
Why?
I don't know.
I don't know. Some people are just turtleneck people, I guess.
But I will tell you, like, even though I have an aversion to things on my neck, I have started wearing a neck brace at night.
Ew.
No way.
I have. It is game changing.
Okay, that is such old man
Less
energy.
pain.
Wait.
Hey, I'm turning 40. I don't
Like
get
white, like a phone, like
No,
Is it
it's
for
like-
the front of your neck or for
No, it
like,
wraps around my neck and it kind of keeps it in place so that I don't get those cricks on my neck and like, like those things that can be pretty bad. You can't like move and turn.
I will say I have seen a little trend coming for females who like want to protect any sort of like crepiness forming between their
is it
breasts.
the $200 pillow?
I don't know.
There's
It's a chest brace that pretty much keeps your breasts like apart. That way, if you lay on your side, you're not getting like the
the
crepey
creases.
lines.
Oh. Well, they sell a pillow. It's like a $200 pillow, and it's supposed to help you lay comfortably on your back. And it's supposed to help.
So, do you use your brace with a pillow?
Yeah, it just kind of keeps it from like, I guess the angle when I'm sleeping on my side, like I think that's been causing.
Wait, can we zoom in on
Can we pause?
when you're like that?
So it kind of keeps it stable. So I'm not like kind of creating that angle.
Okay, I'm interested.
Yeah, and actually I tried it for the first time like 2 days ago. Like I'm not actually got me into it. She started doing it. I'm like, okay, let's see what's this about. I was making fun of I was making fun of her before, but you know what? We're living our best lives.
Yeah, best geriatric life.
That my retainer.
I do wear my retainer very often too.
Well, anyways, going back to, I guess, how to prevent besides neck braces, going back to our treatments that we can do, one of my favorite is the Radius neck wash, a hyperdilute Radius neck wash. I love
Game changer.
Yeah, I mean, I love seeing patients back after they do it with one of you guys. It's such a difference, and normally you can start seeing results pretty quickly. But it's building your own collagen. Again, it's Radius, so it's a biostimulatory filler, and normally we'll do a series of 3, sometimes like a month apart. Mm-hmm. And I think it just provides that like structural integrity to the neck. It helps with the crepiness, skin texture, and just remodeling some of that.
Skin glow, like it gives you a glow.
Mm-hmm.
And it's similar in concept to Sculptra, so you can technically use Sculptra as well. So I do think that this is a part of your regimen that, like you want to use different modalities. I often combine the radiofrequency, the non-ablative fractional laser, and the, hyperdilute Radius in one session. And you just see like the synergistic effect and you get some really awesome results. And typically we repeat this every month for 3 months. Beautiful results.
Yeah, and Sculptra and Radius are technically fillers, but they're biostimulatory fillers, so they're not meant to volumize. So please don't let somebody put hyaluronic acid filler in your neck. I don't think that would
Well, you can do it. This is where I use
devil's advocate.
So I do sometimes treat the superficial necklines with a very soft hyaluronic acid filler. So that there is a role
there
for
is
that.
a place. There's
always a place.
Especially for filler.
Fat reduction. I think one of the biggest misconceptions with patients is what is truly fat versus what is laxity of the neck or skin. And I think sometimes you'll have patients come in that think what they have can be fixed by some of these treatments, but it's just truly that loose skin. So when there is that submental fat, when you can feel that pinchable fat, that's where you can look at things like Kybella that will help to reduce that fat in that area. But when you are looking at things that is true laxity that we do get as we get older, then you might want to look into other modalities, such as maybe a neck lift or threads or surgery in that area.
Yeah. And when you do have that fullness, submental fullness, another great option is submental liposuction. I mean, that's the gold standard. You see some beautiful results with that, and you're actually eliminating the fat in that area. So that's a nice option, especially, if you don't want to go through multiple sessions of, Kybella, which is deoxycholic acid, which, dissolves the fat. I do think that submental liposuction is a great procedure.
Yeah.
Yeah. So we talked about some of the non-surgical like thread lifts. I mean, I think it does have a role. You can see some, mild improvement in that, but I think it's like not very long lasting. Neck lifts, the other extreme, right? So like we see some really nice results. Often they're paired with a facelift and we can see some nice tightening of the skin, but recognize that the skin integrity and quality is not changed. We're just literally cutting tissues and repositioning it. So I'm always of the mindset that you should always still concentrate on, skin integrity, improving the quality of the skin. And if you have a lot of laxity, a neck lift can be very helpful. Yeah,
there's no magic trick or one magic trick. It's best to use a combination of these different treatments to catch it all.
I mean, even things like when you're going in for your laser treatment with IPL or another laser that's treating maybe some vasculars or browns, I think you can still see some nice mild collagen production. And that's where it is important that when you're getting treatments for your face, again, that's why I like that we treat the neck, because over time you might think, oh, those treatments aren't really big treatments, but over time, if you're doing them pretty diligently, you will still have results in that area.
Yeah. And like IPL and vascular and pigment specific lasers can be really good for kind of clearing up that tone.
I love treating poikiloderma. It's one of my favorite things to treat because I
It's
think
also one of my favorite things to say. Poikiloderma.
really,
Yeah.
mine is idiopathic butate hypomelanosis.
That is sexy.
Big word that doesn't mean much.
Yeah.
But I think because the results are so night and day, and you see their before and after pictures, and they look incredible. It's one of my favorite things to treat.
Yeah. The neck is a very complex area. It's often neglected. So I think that we have shone a light on this very critical area, very cosmetically sensitive. And, prevention is always the best. So, treat your neck like you treat your face. But if you have like sun damage, if you have other concerns like laxity, there are options for you. I mean, you just have to, seek the right guidance. So seeing your board certified dermatologist and their team, a plastic surgeon, just making sure that you're getting the right treatment for your concern. And for all patients, you can always do things to help protect your skin and treat your skin. So that's always the first thing on my mind. And then we can talk about procedures and, other things to help your skin integrity as you age.
Yeah, I think the biggest and the easiest takeaway that someone at home could do is just go ahead and start bringing your skincare ingredients down to your neck, especially, your vitamin C, your moisturizers, your sunscreen. So go ahead and just start bringing that down, even your hands, which I'm sure we'll have another episode about just your hands. But even your hands, whatever extra product you have, just go ahead and rub that on the back of your hands. Just start thinking about those places.
Yeah. Great episode on a very critical area. So the neck is very, very important. And I do think that it needs more attention. And if you need help, just make sure you seek the right guidance. And if you have any questions, concerns, if you have any comments for us, please drop us a line, like and subscribe. But until next time, Skinside Out.
Thanks for listening. This episode of Skinside Out is complete. If you enjoyed today's episode, don't forget to subscribe, rate, and leave a review wherever you listen to your podcasts. For more tips, updates, and behind-the-scenes content, be sure to see what fun we're up to on TikTok. Follow us on Instagram and Facebook at Nor Dermatology and Aesthetics. Check us out online at norderm.com. Discover why our patients give us 5 stars on Google. Call us today at 919-617-0717